Hey, welcome to Living the Dream with MS. Many videos ago, I did a video about the MS itch. That nerve-ending phantom itch that many MS patients suffer. And I wanted to expand on that and add a piece. Because many people with MS, myself included, this is why I'm talking about it, suffer from lack of sensation in many parts of the body. And it may not be that it's completely numb, but it could be that it's a very dulled sensation. So I'm going to talk about a couple of unpleasant things, but they are what they are, and it's something to be aware of. With the MS itch, where lack of sensation can be detrimental or dangerous, is yes, you're having the itch, but the actual sensation on your skin surface isn't good. So with the MS itch, many times, and I've done it recently, I've done a couple of these things, which is why I'm bringing it up, is that you can draw blood. You're scratching at something that's not there, but your skin doesn't have proper sensation. So as you scratch, you actually open yourself up. And if you're less aware of it and not paying attention to it, that can lead to infection or poorly healing wounds. If you're on steroids, I'm not thankfully right now, but if you're on steroids and you have a cut like that, you can really get a bad infection because the steroids are suppressing your immune system. Another one. Now, I'm going to forewarn you, this is an unpleasant and very personal situation to the individuals that deal with it. But I'm going to bring it up anyways, and hopefully it helps anybody that's experiencing it. Wiping. Yes, wiping. It's something that I've dealt with, and I'm not going to delve into it because it's obviously embarrassing and personal, but I know for a fact that it's something a lot of people deal with. If you are wiping and you are having sensitivity issues, you can tear or lacerate the area that you're wiping. That can be a problem for several reasons. Obviously, there's a ton of bacteria there. You can deal with infections. Blood can back up, and you can deal with issues in your rectum, your colon, your bowel, all of that kind of stuff. So that's something that I've had to be, and I can't believe I'm discussing this, but it's something that I've experienced recently, and I know a lot of people have had to deal with it, but that's something that you have to be vigilant about. And if you're noticing blood, that's something that has to be addressed, and depending on the volume, addressed medically soon, because the infection and toxicity issues that you can experience are very, very serious. Eyes are another one. Sensitivity with eyes. I've been fortunate with this. I've scratched my eye, but I know people that in wiping their eyes, people with MS get dry eye from medications and whatnot. But with the sensitivity issue, people have scratched their cornea and done other damage to their eyes, which can be very dangerous. So the moral of the story is, not only do you deal with things like the MS itch, but with the lack of sensation, anytime you're touching your body, wherever it is, you have to be extremely cognizant of how you're touching yourself, the pressure being applied, and making sure that you haven't done damage to yourself, because the infections and other things that can happen are quite dangerous. So this one was a little weird, but as I've experienced some of it, and I've seen other videos and questions and blogs, I really wanted to address it. And if you're somebody with MS that has experienced these things and have been horrified, as I was in the beginning, know that it's something that happens. Know that it's not unusual, but know that you have to take care of it and you have to address it, or you can risk long-term injury to yourself. Hopefully this one wasn't too weird for you, but it was one that I felt was important to share. I'm going to keep living the dream with MS.